Even as the world eagerly anticipates the development of vaccines for COVID-19, Singapore continues to use testing as part of its strategy to keep the virus at bay. Cheryl Goh looks at why testing is here to stay, even if a vaccine is available.
For this general practitioner, swabbing is now part of his daily duties. His clinic has been offering polymerase chain reaction, or PCR, tests since the end of August. To minimize contact with other patients, those who come in for such tests are told to go through the back door, while this specially constructed screen helps to protect the doctor.
An average of around 3 to 4 patients per day would be here for these PCR swab tests for travelling purpose. Of course, the fear of having to swab someone with a positive COVID-19 is always present. So that's why my staff and myself will be in full personal protective equipment.
Since 1st December, anyone who needs a PCR test can get tested at approved clinics. You can now walk into GP clinics like this and request for a polymerase chain reaction or PCR test, but it will set you back by up to $200, especially if it's for travel or personal reasons. We also understand that GP clinics can now opt in to offer antigen rapid tests or ARTs to the general public, which costs up to $65. Dr. Chung's work is part of wider ongoing efforts to ramp up Singapore's testing capacity to 40,000 a day. Currently, more than 27,000 PCR tests are conducted daily.
We must have the surge capacity to be able to respond if you're unlucky enough to have another outbreak, to quickly test around infected cases so that we can speed up the containment.
This is where rapid tests can help, especially as Singapore looks to open up more large-scale activities and events. Already, they have been used for MICE events, a mixed martial arts tournament, and cruises to nowhere. 3 bars and pubs that have reopened under a 2-month pilot will also require customers to be pre-tested, and rapid tests could be an option for them.
What it will do is reduce the risk that one of the people in this expanded group coming in may be infected and pass on to a lot of other people. So that cuts down the risk that infected individuals will be involved in a gathering where there are large numbers of people, which can then result in a large spreading cluster.
According to the Health Sciences Authority, Singapore is in discussion with various companies, including AstraZeneca, over vaccines. But even with a number of strong vaccine candidates on the horizon, experts say there is still a lot left unanswered.
What you want to know is not only whether the vaccine can protect against disease in the first place, you want to know how long the immunity would last, right? At least over a reasonable period of time.
I think within next few months, we may have up to 10 different vaccines that are available. It will be another logistical problem. How to conduct vaccinations when the choice is so big.
Experts say even when vaccines do become available, testing is still very much here to stay. Now the key is to continue to develop tests that are faster, cheaper, and hopefully less invasive. Current tests require samples taken from deep in the nasal passage and throat. Those self-administered tests using saliva samples are being trialled.